Good day, everyone. Today, we are to tackle a study involving the reproductive system of a human body, particularly to males. It is titled A Double-Blind Placebo-Controlled Evaluation of the Acute Effects of Sildenafil Citrate on Visual Function in Subjects with Early-Stage Age-Related Macular Degeneration. What is it all about? Sildenafil citrate is effective in treating erectile dysfunction by selectively inhibiting cGMP-dependent PDE5, while also weakly inhibiting PDE6, in which activated PDE6 hydrolyzes cGMP to reduce its concentration, which triggers the sequential closure of sodium channels. As a result, hyperpolarization of the photoreceptors, release of neurotransmitters, and propagation of visual signals occur to postsynaptic cells. Its potential to produce visual effects secondary to PDE6 inhibition was evaluated in double-blind, placebo-controlled phase 2 studies in healthy male volunteers and patients with erectile dysfunction. It is found that there are no significant changes in visual acuity, intraocular pressure, contrast sensitivity, photostress test, or pupillometry measurements, although minimal changes in electroretinograms were observed at sildenafil doses ranging from 550 to 200 mg compared with placebo. Overall, abnormal vision was reported by 3% of patients receiving 50 mg doses and 11% of patients receiving 100 mg doses of sildenafil in phase 2 or 3 of clinical trials. The aim of this study is to assess the effects of a single 100 mg dose of sildenafil citrate on visual function in men with early-stage age-related macular degeneration. To determine the degree of acute administration of a single oral 100 mg dose of sildenafil further affects visual function in subjects with early-stage AMD. The effect of this dose of sildenafil in volunteers and patients with erectile dysfunction found reversible transient decreases in the A wave and B wave amplitudes and a delay in the scotopic implicit time that were not considered clinically significant. Patients with early stage of macular degeneration have partial impairment of visual function in which PDE6 inhibition could worsen the situation.
For the methodology, the study was a single-center trial conducted in compliance with the Declaration of Helsinki and with Institutional Review Board approval. For the screening of the study participants, 9 male subjects aged 55 years or older with documented early-stage age-related macular degeneration or AMD, characterized by coalescent soft drusen and/or geographic atrophy, who had corrected visual acuity of 20/40 or better in at least one eye, and body weight between 45 to 100 kilograms was enrolled and has completed the study. Subjects were excluded from the study if they take drugs known to affect visual function within a month before the study, if they had eye disorders, or if they had clinically significant abnormalities that could alter the systemic exposure to the sildenafil, such as excessive alcohol use or history of other substance abuse. If they do not, subjects were screened for study eligibility on the basis of a physical examination, including supine blood pressure and pulse rate, urinalysis, hematology, and biochemistry testing. Subjects were randomized to double-blind treatment with a single dose of either placebo or 100 milligrams sildenafil. Study drug doses were taken between 8 a.m. to 10 a.m. at least 1 hour after a light breakfast with 240 milliliters of water. Subjects were not allowed to take certain drugs known to affect visual or retinal function for the duration of the study. The effects of sildenafil on visual function were assessed using a battery of 6 visual function tests. First is for visual acuity. Using 3 early treatment diabetic retinopathy study or ETDRS wall charts at 10 feet. The smallest line on which most letters could be read by each eye was recorded. Results were classified as deterioration, improvement, or no change in visual acuity. Second is the Amster grid. Subjects were asked to assess whether their vision was normal. If not, they were asked whether they noted a central or peripheral scotoma or distortion of vision. Results then were classified as worse, better, or the same.
Third, color discrimination or D15 test. Subjects were asked to arrange 15 colored discs in order of gradually changing hue under standard simulated daylight conditions. Measures for the confusion angle, which identifies the type of color defect, the confusion index, which quantifies the degree of color loss relative to a perfect arrangement, and selectivity index, which quantifies the lack of randomness in this arrangement. Fourth, traffic light test. Subjects were asked to first identify the color white, red, amber or green from a single light source and then re-identify the color each time it was changed for a total of 8 color identifications in randomized sequence or test. It is recorded correct or incorrect responses. Fifth, Humphrey parametry test. To assess visual field, the 30-2 program on the Humphrey Visual Field Analyzer was used. Sixth, photo stress test. The subject looked directly into the light of an ordinary handheld ophthalmoscope held less than or equal to 3 centimeters from the eye for a period of 10 seconds. After the light was removed, the subject was asked to start reading ETDRS test letters, one line larger than best acuity. Recorded the time required to read any 3 of the ETDRS test letters. Pharmacokinetic analysis. Blood samples of 6 ml were collected and plasma concentrations of sildenafil and its metabolite UK 103-320 were assayed using automated sequential trace enrichment of dialysides, followed by reverse phase high pressure liquid chromatography or HPLC with ultraviolet detection. The safety assessment subjects who experienced spontaneous visual abnormalities independent of visual test results completed a visual disturbances questionnaire providing data like the date and time of onset and resolution and description. Statistical analysis. The ANOVA model included terms for subject, period, sequence, subject within sequence, baseline value, time post-dose, treatment, and interactions between time post-dose and period, and between time post-dose and treatment. 95% confidence intervals or CIs for between treatment difference were calculated. Statistical tests were two-tailed and significance was set at p less than 0.05.
Result in this, some concerns have been about the use of sildenafil by individuals with pre-existing retinal disorders and its possible effects on their visual function. In the present study, treatment with a single maximum recommended dose of sildenafil, which is 100 milligrams, produced no acute visual effects compared with a placebo in a group of 9 men with early-stage age-related macular degeneration or AMD, and some degree of reduced visual acuity. No clinically relevant changes from baseline in visual function in either the right or left eye were observed, as assessed by a battery of 6 visual function tests that include the Humphrey perimetry test, D15 color discrimination test, the Amsler grid test, the traffic light test, ETDRS visual acuity test, and a photo stress test as seen in Table 3. Here, the mean adjusted differences between sildenafil and placebo single-dose treatments for changes from baseline and visual function test scores have been presented. Furthermore, there was no evidence of discernible pattern of errors in any visual test as a function of time after dosing with sildenafil, nor a consistent pattern of errors within one subject. The effects of sildenafil on blood flow in the eye could have important implications for patients with AMD or other eye disorders. The effects on the ocular circulation specifically have, to this point, been variable. Different studies show that the vasodilatory properties of sildenafil do not seem to be producing a decrease in ocular blood flow. Favorable results from the current study show that there were no significant acute changes in vision after a single dose of sildenafil in a small sample of men with early-stage AMD.
To summarize and conclude the presentation, a study on the double-blind, placebo-controlled evaluation of the acute side effects of sildenafil citrate was performed to assess the effects of a single 100 milligram dose of sildenafil citrate on visual function in men with early-stage age-related macular degeneration. With the use of a randomized double-blind placebo-controlled clinical trial, 9 men along the ages of 59 to 85 years old were early-stage age-related macular degeneration or better corrected visual acuity in at least one eye were selected to receive either placebo or 100 milligrams sildenafil citrate as a single oral dose. After a week or 7 days to 14 days, these men received the alternate treatment and underwent visual acuity, Amsler grid, color discrimination D15, traffic light, Humphrey perimetry, and photo stress testing in each eye before and at specific intervals within 8 hours after dosing. Results have shown that comparing the side effects with placebo, no patterns of errors were clear in any visual function test following sildenafil administration. There were no statistically or clinically significant changes from baseline observed in the Amsler grid or traffic light test. Sildenafil treatment was related with mild to moderate headache, flushing, and rhinitis. With gathered data, the study was able to find out that a single 100 milligram dose of sildenafil was well tolerated and produced no acute visual effects or exacerbation of pre-existing visual impairment among 9 men with early-stage age-related macular degeneration. And that is all for this presentation. Thank you for listening, and we hope that you learned something.